We had a problem with the ClickFunnels email list, so we weren't able to get the email out to folks today. Those of you that joined had to fight through a mountain of confusion. I appreciate your efforts. First thing I want to mention before we get to the show, I got a subscriber and actually a patient called me and said, "Can we talk for a minute?" And I said, "Sure." He said, "You know, this message about vitamin D just isn't getting out there. Can you, it's so critical. It's critical for older adults, younger adults, kids." And I said, "Yeah, I know. I've put it out there many times." And he said, "You know, can somebody get the attention of the national news outlets?" And I said, "I wish I could. You know, I'm one of those single individuals, and the other individuals that I know of that are doing this both dwarf me. John Campbell and Dr. I think it's Neufeld or something at Med Cram. Both of those guys have mentioned it as well. And the national news outlets have not done quite so good a job of covering that, and that's unfortunate. Vitamin D does appear to have a significant impact on the immune system, and again, as this viewer was saying, a lot of this damage does appear to be due to the immune system and what we call a cytokine storm. I would certainly I'm certainly keeping my vitamin D up, and I would recommend that you do as well. We've got several videos. We've got about a dozen videos on the topic of vitamin D in general. We've got, what, 4 videos on supplements like vitamin D and COVID-19. So there's a lot of information out there, and I would be sure and cover it. Be sure and make sure that I'm taking mine. If I were you, I would take yours. Before we get to the to today's topic, which is the rehab period, and I use the term rehab not lightly. My wife is a physical therapist and has done a boatload of work for rehab for people post-stroke and post-heart attack. And some of the rehab associated with post-COVID-19 disease reminds you of post-heart attack, post-stroke rehab. And guess what? We've talked about both of those items, the similarities in terms of heart damage and the strokes that are occurring related to COVID-19. Now, before I went there, I wanted to make sure, just cover very quickly this one slide on social distancing in New York versus the USA. This item is getting a little bit dated. It's about 2 weeks ago in terms of this one image that I want to cover in just a minute. And that is, we're all getting out there. The states are opening up. We've covered that before in terms of almost all of the states loosening their lockdown recommendations. Texas, for example, is having a significant increase in cases. They just had the largest number of cases in a day that they've had. I believe it was 1,000 in one day. And
It's been increasing by thousands since their reopening. That's not surprising to a whole lot of us. One of the things I wanted to do is make sure that we showed this image before that image got too dated. This came from Aaron Bromage. This was a social media post, and this is the data for isolation in New York versus the rest of the country, and number of new cases. So if you look at New York and you look at the cell phone and some of the other information, New York does appear to be doing a fairly good job, maybe better than the rest of the country in terms of maintaining isolation. And some of the data that drives people to say, look, it's time to get back out, was some leveling of the U.S., or some perceived leveling of U.S. cases. If you take the New York cases out of the U.S. cases, though, this is what this curve looks like. The U.S. curve has never really slowed down. So it's a warning that we need to be very careful as we start going back out into the workday world. There have been a lot of warnings out there, a lot of folks that it's an incredibly political, incredibly emotional issue. It reminds me of a couple of comments and quotes I'd have from people in my past. One was my grandmother, and she used to say, you know, when somebody looked at something and decided and saw the risks and said, I'm going to do it anyway. And if they got hooked on it, she would say, yep, you didn't believe cow horns would hook, did you? And I know several of our subscribers, in fact, most are my age, baby boomers. I'm sure you've heard that from your parents and grandparents as well. That phrase, though, that quote implies that these are frivolous decisions to get out there. In some cases, they are. In many cases, they're not. In many cases, people are desperate because of the economy. And that reminds me of another quote from an old friend of mine and business colleague. His name is Stuart Clark. He used to say, desperate people do desperate things. And there's a lot of desperation going on out there. The impact on the economy is not minimal. So today's features: COVID-19 symptoms appear to linger long after recovery. Again, there's, and as you'll see, rehab component to this. Not so much for the people that had few or no symptoms, but clearly for the people that had COVID-19. Upcoming topics: it attacks not only the lungs, we know that. The comeback is feared as the states open up, and this is that I just covered some of that topic. And it has pushed the rise of telemedicine, which, you know, is one of the silver linings that we discussed a while back. Surveillance and privacy in the time of COVID-19. We've covered that a couple of times. We also have covered the fact that there was some previous evidence of previous coronavirus, but not like years or even a significant number of months prior to late 2019. We went into some detail on that in a previous video. We've talked about herd immunity a couple of times. And this last one was, can we practically achieve herd immunity without a vaccine? The answer is, well, yes, you can, but there's going to be a lot of infections and a lot of death on the way. We discussed a mutant, more contagious coronavirus that was discovered and documented by the Los Alamos group. And what they showed, I think it was D613G. That's not unusual when you have a pandemic of a virus, just like you get with even seasonal flu. We've often had significant mutations during that spread throughout the country or throughout the world. There appears to have been some here. One of the things that Los Alamos group said in relation to this D613G, the old European virus appeared to have started the infections in New York, but was taken over by this one. this one within a matter of days, indicating that it is significantly more infectious. Now, what you typically see is in these mutations, these changes, is that the newer mutation takes over. It's usually more infectious, more contagious, or else it wouldn't take over. Now, is it usually more virulent, more disease-causing? Actually, usually not, because the less virulent a parasite is, the more effective it is at spreading. However, that's not so clear on this one. Your dentist's office, we had a very popular video where Doug Thompson, a global expert in this space at this point, has provided us with a lot of detail on how to be safe in your dentist when you go back to the dentist. And we've talked several times about coronavirus in children. The bottom line still is coronavirus is much more of a risk for older people, especially those of us that are getting into our midlife ages and prediabetes. But there are some significant issues that occur in children, and when they do occur, again, very significant. Some of them similar to Kawasaki disease, inflammatory disease. I'm going to skip over the updates on remdesivir. We've covered that. Skip over the comments about, yes, we'll make time if you have questions or concerns and need some just plain old urgent care during the time of COVID. As we've talked many times, the major risk factor for this is the same as the major risk factor for heart attack and stroke, high blood pressure, and especially prediabetes. So most of us, unfortunately, that have prediabetes don't know it. So find out, give us a call, look us up on one of these numbers, and we can help you answer that question, whether or not you have prediabetes. And like 90% of people with prediabetes, you and your doctor don't know it. A lot of people have gotten CIMT webinars through people like David Meintz, Doug Thompson, Todd Eldridge, and just haven't had a doctor to go to clarify what that means in terms of what to do next. And we've got a webinar to help you understand that. Bottom line on the book, we'll keep you posted on it, but unless you're feeling extremely lucky, don't depend on the standard way of looking to see if you're going to have a heart attack. The standard way is to get a stress test. Look it up. I'm not the only one. It's crystal clear. Look up false positives, false negatives, and stress tests. The last way I would look to see if I'm at risk for heart attack and stroke is to get a stress test. And I would also expect that to take me to the cath lab and probably to a stent. And either a negative stress test or going all the way through that process of positive stress test, cath lab, and then a stent. Both of those scenarios, whether you got the easy one or the hard one, leave you with a false sense of security. What you need to know is if you're one of those people, those 90% of people that have, the 90% of people that do have prediabetes that don't know it. So thank you for your interest. We are going to cover the topic of the day, the program of the day, COVID-19, after you've recovered. Lori, do you want to hit the water ball? So surviving COVID-19 was merely the first leg of the journey for many people overcoming it. Debilitating symptoms can last long, even after a person's body has gotten rid of the coronavirus. When sort of like what happens with a heart attack or a stroke. When severely ill patients get past the ICU or ventilator, Many find they still need help, therapy, and or rehab to return to normal life. Many COVID-19 survivors find themselves in physical and financial uncertainty, unable to shake sickness, fatigue, and other illnesses, and to get back to work. Thus, the experiences of COVID-19 survivors may be instructive to nations mulling to get their economies back in action. It takes a long time, said Morena Colombi, 59, who lives in Trevizzano, Italy. I can't get back into my natural rhythms. Ms. Colombi was tested negative on March 16th and was counted among the COVID-19 recoveries. 5 weeks later, she still experiences cough, fatigue, shortness of breath, and aching muscles. Gordon Quinn, who you see in the pictures, 77, a renowned Chicago filmmaker, spent about a month in the hospital. 2 weeks of that was on a ventilator. By mid-April, he was well enough to leave the hospital, but he still couldn't walk very far on his own, nor control his fingers. You see what I'm talking about regarding, sounds a lot like a stroke. He also had trouble swallowing and speaking. When you're that sick, the question is, are you going to live or die? Quinn said. Once you start rehab, the whole mindset changes, because rehab is about getting your strength back and getting back into the world. Most people who catch the virus have few symptoms or none. So for them, it's not an issue. But some get very sick, often with pneumonia. Any pneumonia damages the lungs, which can take months to heal. Doctors warn that the harm might not be completely reversible. Given that comment, I'm going to go off script for just a second and mention that very first article from the New England Journal about the experience with kids with coronavirus. It covered several hundred kids, and only 3 died. Those 3 died for reasons other than the coronavirus. But here was the reason I'm bringing that up. The majority of those kids had ground glass appearance on their chest x-rays, even though they were not symptomatic. So there is a lot. It's sort of like the part of the iceberg under the water does appear to be significant damage to the lungs. How long-term is that? That's a big, big question. And I think it's way too early to answer it. We just don't have the evidence yet. So back to the slides. But even those who have avoided pneumonia describe persistent and unexpected symptoms. Bones feel like they're broken. The senses are dull. Stomachs are constantly upset. And such things make the simplest tasks taxing. Some have had trouble with blood clots. Others have had, and you know, a stroke is nothing but a blood clot. Most strokes. Heart attacks are nothing but blood clots. If it goes to the brain, it's a stroke. If it goes to the heart, it's a heart attack. Others are having cognitive issues, such as being unable to solve simple problems, again, similar to stroke rehab. Studies also point to kidney, heart, liver, and neurological damage, and no one knows what the long-term prospects are for these patients. Patients recovering from COVID-19 face some of the same obstacles as others who have been on ventilators, such as trouble swallowing and talking. Laurie, are you going to be able to play the video?
Yeah, the way I've described it is that this is the sickest that I had been in my adult life. And I have 3 small children, as you can see in some of the pictures. So they are petri dishes. I get sick a lot, but this one really dug in and it just lingered. I mean, it didn't let go for 2 full weeks. And so just sort of slogging through that was really difficult. And not only did I get sick, but my husband fell ill as well. The kids all complained of symptoms. So we were just one big germy household slogging through this together.
Well, we're glad you made it to the other side, Ilan, of course. But your piece does highlight a number of serious questions that people like you and the thousands around the world are grappling with when it comes to recovery. When can you see people? Are you actually immune? What sort of testing do you need? I mean, are there any answers to any of these questions?
Yeah, one thing that I realized as I sort of came out on the other side of this is that actually knowing that I had coronavirus was the most concrete piece of information that I had in this whole process. Now, it's unclear. There are conflicting guidelines of when I can stop isolation. My doctor told me 72 hours after my fever ended. The county told me 8 days after my fever ended. The World Health Organization says 2 weeks after my symptoms resolve. Does that include my cough or does that mean the fever? All of these are questions that we will have to deal with on a very individual level. There are, the president, state governors, national officials who are going to have to be dealing with the big picture. But in order for recovery to truly happen and for the economy to reopen, individual households are going to have to make hundreds of tiny decisions on each of those kinds of questions. And how soon we can get back to normal depends on what all of us do and how quickly we feel confident in my own health, in the health of my family, and the ability that I have to go out and not infect other people.
So thank you, Lori. Now, as you can tell, we're to the Q&A section. Tony on crypto. Dr. Eric Berg has covered D3 as well. That's right. I forgot to mention Dr. Berg. And again, he's another one like MedCram and John Campbell. Their channels dwarf mine. If they've all covered vitamin D3, and if they're not going to listen to those channels, I'm not sure they're going to listen to mine, or I'm very skeptical that they will. Clinton in. I'm taking D every day. Even set an alarm on my cell phone so I won't forget it. I think that's a good idea, and I'm certainly taking D every day as well. I will tell you this: if you go into the science on it, even if you don't, you should monitor your blood levels of vitamin D, maybe quarterly or half year until you get it stabilized. I can tell you from a couple of things. Number one, I think I haven't met a patient yet that I felt comfortable saying you don't need to test and you don't need to supplement. I would recommend supplementation. Number two, you can supplement too much. People have died from it. That goes from taking like 50,000 units multiple times. Number three, there is no evidence anywhere in the science that anybody has ever gotten into trouble with supplementation of 5,000 international units per day. Hope that's helpful. Chuck K, hi Doc, can you talk to COVID related to being overweight and leptin resistance? Yes and no. I can obviously cover some of the basic items. It didn't take long. Within a few weeks, the folks in China were seeing that people that had hypertension and pre-diabetic tendencies appeared to be much more associated with, or much more at risk for COVID-19. Also men. So it didn't take long after that to get more and more focus on that. For those of us who don't know, and that's a lot of people, maybe most of us, high blood pressure is called idiopathic, meaning we don't know where it comes from. I would argue with that. I think the preponderance of the evidence does indicate that the majority of high blood pressure is probably associated with prediabetes, unrecognized prediabetes, a thing called AGE, advanced glycation end products. The most common, most well-known advanced glycation end product is hemoglobin A1C. So then you start going back and asking, well, okay, if prediabetes is a major root cause for a heart attack, stroke, obviously kidney disease, and now COVID-19, then what causes that? Well, there's several things. It's genetic. 9p21, the quote heart attack gene on the p21 area of the 9th chromosome is very much a diabetes gene. But there are other issues associated with diabetes and prediabetes as well. Genetics, epigenetics. For example, we've shown in laboratory animals that the next generation from an obese father is usually going to be diabetic, have higher increase for diabetes. We've also shown this in humans. If you're every ounce that you're when you're born, every ounce over 8.5 pounds increases your risk of type 2 diabetes. I was a 10.5 pound baby, so even though I kept my weight in a good number, tended to have a BMI in the low 20s, I started developing prediabetes early in my late 50s. That's really probably not so early as most of us have begun to think. But that number, that last concept, is maybe one of the biggest issues, maybe even more important than obesity, and that is aging. If you look at the numbers, a lot of people would say, well, the diabetes epidemic has happened because of the obesity epidemic. I wouldn't say that so quickly. I would look at aging of our population as well. And I would tell you, look at the rest of the world. Do you think about heart attack and stroke being a disease of people with obesity, young people with obesity? Yeah, they're at increased risk, and so is diabetes. But we've always thought about heart attack and stroke as being a disease of aging. The bottom line is that aging is probably the most powerful determinant. But sure enough, having that extra body fat is a major driver for what Chuck K brought up, and that is leptin resistance. So yes, overweight and leptin resistance are big, big deals for this. Chuck, that's about as far as I'm planning to go with that. Thank you for bringing it up. Clinton N. New York City remains the epicenter of the HIV/AIDS epidemic in the United States. Not sure where you're going with that in terms of COVID-19. They clearly have some crossover, at least in terms of mechanisms and impact and targeting on the immune system. Alex Sweden, good morning, Doc. Is high insulin level due to pre-diabetics as harmful as high blood sugar to arteries? And when is the best time for insulin level test, so-called C-peptide test? Well, a couple of really good questions, Alex. Thank you for asking them. The bottom line is nobody knows, but it's under major significant debate. You do see both situations. You see where people have high blood. I see patients, gosh, about 10% of the patients I see now that we have insulin response in terms of our OGTT, about 10% of them have relatively normal OGTT numbers, but they have very high, but have high insulin. So what that means, and you see that all the time, that kind of person with a significant amount of plaque. So their body is able to control that blood sugar level, but it still has to put out a lot more insulin than is normally necessary in order to do that. That, by the way, is a major place of where the term insulin resistance comes from. And yes, that is a very, what we call inflammation-genic causing situation. It also causes, because it's inflammogenic, it causes plaque. We also know, especially for people that get to more of the 5th level of diabetes, where their blood sugar is going up and yet they're not putting out significant insulin at all, those people continue to put down plaque, even though they're not putting out a lot of insulin. So it does appear that both of these will cause both insulin in absence of glucose and glucose in absence, or insulin in absence of hyperglycemia, and hyperglycemia in absence of insulin. It does appear that both of these do cause inflammation and plaque, and therefore increasing risk for things like heart attack, stroke, kidney disease, COVID-19, you name it. Joe Riley is there. Thank you, Joe. Good to hear from you. Jerry West. Where did we go? Jerry West. It can linger for mild symptoms as well. The disease can wax and wane with mild symptoms for up to 6 weeks. Mild disease is poorly understood. Patients are locked away and not seen by physicians. Good point, Jerry. I agree. And here's part of my question. What's causing that? I agree. It's not that well understood. Part of me looks at it and says, you know, is this ongoing damage to lungs that's creating time to heal? Is there a lot of fibrosis that's being created in the lungs and elsewhere? Is there inflammation that's being created elsewhere? Are there small subclinical, unnoticed, asymptomatic levels of clots going on in some of these people, which are damaging cells throughout the body, kidneys, lungs, heart, brain? I think that remains to be seen. It's a great, great question. Clinton N., how long for glass opacities to heal? They take a while, weeks to months. Robert Simpson, although symptoms may linger, it is highly unlikely a person is infectious. Correct. If the person's not spilling the virus, I mean, that tends to be the same in any of the viral and bacterial issues. If the person's not spilling the virus or the bacteria, they're probably not infectious. Joe Riley, 97%, 77 beeps per minute, 97.7 degrees. Thank you, Joe. And I'm at similar numbers today. Little Viking Coach, have you hit the, yes, thank you very much for the reminder, Little Viking Coach. Folks, if you hit that button, it'll tell the algorithm at YouTube that this is something worth watching, and it'll help it go ahead and push that out to other folks. So thank you for the reminder, Little Viking. Richard Taylor, seeing that vitamin D is very important. Italy, and then we lost you, Richard. Joe gave us a $4.99 super chat. I have faith they will listen to you. Thank you, Joe. I think some people will. Are the NBC, CBS? I'm dating myself. Gosh, I'm blanking on who the CNN. You know, some of the new Fox. I don't know whether they're going to listen or not. Little Viking Coach, you can take vitamin D in 1 large dose a week if you have trouble remembering to take it. That's very true. And Little Viking Coach, I will tell you, that is where most of the hypervitaminosis D patients come from. They get those 50,000 international unit doses, and they forget that it's a once a week, or it's not effectively, the information doesn't effectively get from the doctor to the patient. And we had a patient just like that. We interviewed her. She came in to me for a heart attack and stroke evaluation, had a vitamin D level, I think it was like 115, panic level. So I called her immediately and walked her through some of these issues. She stopped taking it. We did an immediate evaluation. She did have some impact on her kidney function at that time, but it resolved over the next month or so. Unfortunately, with some people, it hasn't. So bottom line, if you take those large 50,000, 40,000 international unit doses, be very much aware that those are the most common way of getting hypervitaminosis D, and it usually comes from taking a weekly dose on a daily basis. Thanks for bringing it up. Little Viking Coach, Dr. Berg has a good video on D3K2 for hypertension. Well, that's my number 2 most watched video has to do with vitamin K2. I've got about a dozen on K2. Richard Taylor, if one is already on BP meds and heart meds, is that person still more vulnerable to a bad attack of COVID, or is it a random thing? They're still more vulnerable. Now, I guess one of the questions might be, are they less vulnerable than they would be if they weren't taking it? I don't think we know the answer to that. I think for most of us, we have to guess. And I think most of us would guess, yes, you probably are less vulnerable if you're taking your medication. So thank you for the question. Erland FR, one simple way to reduce trips for groceries is to fast. Exactly. One of the simplest, there's a lot of interesting things about fasting. People say, well, I can't afford Prolon, it's expensive, and I can't afford Optavia, it's expensive, and I can't afford this or that, and it's expensive. How expensive is fasting? They also say, well, that's too much of a headache. Counting carbs, doing a whole 30 or all of these different diets, they are very, very difficult. I have to be, and I've got a family that's not going to participate with my diet, and I don't want to mess them up. How complicated is it to fast? It's neither expensive nor complicated, and as Erland mentioned, in the age of COVID, it keeps you out of grocery stores and getting coughed on and breathing air that's just been coughed out the past hour or so from a COVID patient or a coronavirus patient. 5-day fasting mimicking, 3-day fasts, and 1 meal a day save a lot of food. Absolutely. And guess what? They save a lot of healthy life as well. Most of us are eating way too much. Result, food lasts longer and fewer trips to the store. Thank you very much, Erland. That's one of those things that's just amazingly obvious. You go back and you look at the major, there are a lot of people, most of this world at least claim some sort of faith or not. And if you look at the major religions of the world, almost all of them, or all of them that I'm aware of, have a significant component of fasting as part of those belief systems. Fasting is just, we've been for the past couple of 100 years where fasting was considered bad, and it's not. It's actually very healthy for you. Thank you very much, Erland, for bringing that up. Alex Sweden, sorry, doctor, regarding my previous question about insulin level tests, I didn't get the answer to when is the best time to test insulin level test. Oh, okay. So here's the thing. That's sort of like blood glucose. There has been this desire from day one to get a blood glucose 1 and know that that's going to be the one that you need. So with both of them, you tend to get fasting glucose. Well, I see it all the time. I mean, I do this for a living. I just see it every day where people had a normal fasting glucose. And many of them most of them didn't get a fasting insulin, but of those that did, many of them have a fasting insulin. And they say, well, you know what? All I need is a fasting glucose and a fasting insulin. I can get my HOMA-IR, which is the ratio between the two. And the bottom line is, HOMA-IR does not show you the result of a challenge. And the challenge is, and by challenge I mean taking a significant amount of carbs. And the challenge is a significant issue. I've seen it, I routinely will see that. People with normal HOMA-IRs, normal fasting insulin, normal fasting glucose, and they just had bad numbers as soon as they started challenging their metabolism with a glucose or carb challenge. We've had several discussions over the past few videos about doing a OGTT at home, and you clearly can. You can do an OGTT at home with a finger stick device or with a CGM Libre monitor. Now, those are very helpful, and I've got a lot of people that do them. The bottom line, though, gets to Alex Sweden's issue. Even if you're doing that, you're missing insulin. And as I've said, I will, about 10% of my patients these days I'm seeing come in, have a total, if not totally normal, a very close to normal OGTT. In other words, very close to normal glucose tests, not only during fasting, but at 1 and 2 hours after you challenge them. And Alex, I am going to get to that last thing in just a second. But you'd still, these people will have normal glucose numbers, but then it'll take like twice the insulin to keep those glucose numbers normal. So again, you're missing a major part of the boat. I just had a patient a couple of weeks ago who we had followed for a couple of years, and I had suspected it. We could not get an insulin response on him. And sure enough, he came back with an insulin response for the first time, and he had insulin values up close to 200, way over 150 recently. And it's like, significant issue. And you don't know about it until you test insulin. Now, Alex's question is, when do you test for insulin? You test for it through the full challenge. Number one, you get a fasting or basal insulin rate. That should be 5 or less. Number two, you challenge it. And with a standard OGTT, the challenge is 75 grams of glucose. With a craft insulin protocol, you challenge it with 100 grams of glucose. And with others, you do different amounts. But most of the time, it's with 75 or 100 grams. And then again, it depends on the protocol. Some of them have you getting it at half an hour, 1 hour, 2 hours, 3 hours, and 4 hours. That sounds more like the standard old craft insulin profile. The standard OGTT that you'll get with insulin response that you'll get from Quest Labs is going to be fasting 1 hour and 2 hours. And you get insulin at each of those times, just like you get glucose. Alex, I hope that has answered your question. A lot of people say, well, is it better to go ahead and get 3rd and 4th hour? The bottom line is that it is. Yes, you tend to see problems at 3rd and 4th hour, sometimes problems that you wouldn't have picked up on the first 2 hours. But the first 2 hours in that fasting are the most important, most critical. So, little Viking coach, Jesus, Buddha, and the Prophet Muhammad only agreed on one thing, fasting. Joe Riley, my fasting was 83, but 1 hour OGTT was 59. Now, excuse me, what am I saying, 59? Dyslexic moment here. But my 1 hour OGT was 255. Thank you for sharing that, Joe. And again, doesn't matter whether you're in a challenge situation or not. One of the major criteria for full-blown diabetes or frank diabetes or type 2 diabetes, whatever you want to call it, no longer prediabetes, is anytime, including during a challenge, that you get a blood sugar level through any of these mechanisms, including Libre, Dexcom 6, finger stick, or Quest Reference Lab. Anytime you get a blood sugar number over 200. So thank you again, Joe, for sharing that. You know, you're like many of these people that say, Doc, we write in it and it's on the comments. They say, Doc, look, I did your tests and I didn't come back pre-diabetic. I came back full-blown diabetic. No wonder I've got plaque. And my doc's been telling me for years I'm fine. Erland, FR, I use coronometer to make tracking food easy. The coronometer does appear it appears, if not the best, one of the best out there. I also weigh everything. Doing this, I can maintain 70, 20, 10% fat, protein, carbs. This keeps my glucose in a safe range. Thank you so much, Erland, for sharing that. Thank you, Joe. And thank you to the rest of you. It's, I think we'll get out a little bit early today, but still 43 minutes is a long time in terms of YouTube videos. Thank you so much. Talk to you later. Any questions, comments?